I'm Dr. Teach Kraljian, and I want to talk to you about one of the most common things that we see in clinical practice, which is a patient that comes in with chronic gastrointestinal complaints, but is eating perfectly, doing everything right, taking handfuls of supplements, and still suffers from chronic GI issues like bloating, distension, constipation, inflammatory conditions in their gut, pain, and so forth. So typically, the patient comes in, they've usually seen a long list of healthcare professionals. You ask them to see what supplements they're taking, and there's a huge list of different supplements. You ask them about their diet, and they're already gluten-free and dairy-free and even on an autoimmune paleo diet or off nightshades, or they're doing all these dietary restrictions, and they're even making their own kombucha. They're doing all these things to really support their gut, and they tell you that if they don't do these things, they can't function. And they're really frustrated because they would expect, and all the healthcare professionals that they work with would expect, that if they eat so well, eat so clean, and then take all these different digestive supplements like probiotics and enzymes and various other digestive support products, that their GI symptoms should go away. And these patients are what we call unresponsive gastrointestinal patients. In the Kraljian Institute Gastrointestinal Clinical Strategies and Treatment Applications, we have a whole section that really goes into this type of patient because it's such a common thing that we see today. So the first thing that you need to realize about these types of patients is they will absolutely not respond to any special further GI support. As a matter of fact, if you're going to continue supporting their GI tract as a way to fix this condition, you're absolutely certain to fail, because the mechanism for these conditions is usually something that is causing dysfunction in their GI tract. So you have to really move out of the GI tract and figure out what is the cause. So one of the most common causes for this is actually intestinal autoimmunity. So many of these patients are in the early stages of ulcerative colitis or Crohn's, or they're not actually progressed to the point where they can diagnose in the standard model with different types of scope analysis and endoscopic analysis and so forth. But they have tissue antibodies that are elevated specific to gastrointestinal target proteins. So many of these patients actually have intestinal autoimmunity, and the clinical treatment approach for them needs to be looking at all different mechanisms that are driving their autoimmunity besides supporting their gut. So this is a really common mechanism. A second common mechanism is many patients are on medications that completely shut down the parasympathetics, and these patients typically can't produce saliva, their gastrointestinal motility is completely compromised, and these simple drug interactions sometimes is overlooked, and these patients never get better. Another common cause of unresponsive gastrointestinal patients are patients that suffer from early neurodegenerative diseases. Neurodegenerative diseases like Parkinson's especially is critical for this clinical presentation, because Parkinson's disease is a condition in which a protein called alpha-synuclein aggregates and builds up in the nervous system of the gut called the enteric nervous system, and then that gets in the way of motility and normal bowel function, and these patients typically end up with constipation first, then bloating, distension, and then small intestinal bacterial overgrowth, and then the whole list of things that come along with a gut that really can't produce enzymes and can't activate intestinal motility. So some of these patients actually have Parkinson's disease. But remember that Parkinson's disease in these early stages with gastrointestinal dysfunction may not have any tremors, that it may actually take 20 years before tremor presents. So you have to be able to, as a clinician, determine if they have early Parkinson's disease, which you can only do through some key physical exam findings. The next thing is the gut can become inflamed for a long period of time, and the actual enteric nervous system can degenerate, just like the brain degenerates, the gut can degenerate. So these are some of the most common causes of why patients that do not respond to comprehensive dietary gastrointestinal protocols may come into your office and continue to suffer from GI symptoms. And if that's the case, you really have to look deeper in the gut. So in our gastrointestinal module, we're going to go into how to find these mechanisms, and then most importantly, what to do for them. Thank you for your attention.